You're on mute, Jen.
Thank you so much, Kassandra. First rule of moderating, take yourself off mute. All right, everybody. I just want to welcome you all to this session for the Center of Excellence for Infant and Early Childhood Mental Health Consultations Conference, Equity from the Start. My name is Jennifer Drake Croft, and I will serve as your session moderator. I am joined by Mercedes Valdeberas, who will serve as our technical host. This session is being recorded. Transcription is available through the Zoom platform. And should you have any questions, please feel free to relay your questions in the chat. We will have time at the end of the session for questions and answers with the presenter. That said, I'd like to pass it over to Elizabeth Groginsky, Cabinet Secretary of the New Mexico Early Childhood Education and Care Department, and Kassandra Gonzales, who is the Infant and Early Childhood Mental Health Consultant Coordinator, who will be conducting our workshop with us today. So without further ado, passing it on to you.
Thank you, Jen. It's great to be here with everybody at this important conference. And I think Kassandra has our slides.
Yeah,
she's going to put those up. We also are excited to have some of our core team members on here as well. So it's nice to see Deb Harris and Don Yazzie, and I may have missed a few others, but we want to share a little bit about our experience in New Mexico developing a statewide infant early childhood mental health consultation program, a mouthful. We are in the infancy stages of this, I believe, but we're moving into toddlerhood and into pre-K here soon. But if you want to go to the next slide, I'll just share briefly what we're going to talk about between myself and Kassandra. Just share a little bit about our background, talk about the early stages of developing this statewide implementation. We want to talk about the development stage also. And then Kassandra is going to close us out with the implementation stage, since she has been leading that effort with an incredible group of professionals from around the country and the state. So here I am with our Assistant Secretary for Native American Early Education and Care at the Kiowa Pueblo groundbreaking for a new child care center with their Child Care and Development Block Grant administrator, tribal administrator. I have been working here in New Mexico since late 2019. Our department officially went live July 1, 2020. And so this was a big transformational change for New Mexico to take programs and services that had been housed in 3 different state agencies and put them under the Early Childhood Education and Care Department. I think the governor saw that my 2 decades of experience working at the state and local level in both public and private human services was a good background to come and help her and her administration start this new department. And I think we have made great strides we just finished our 3rd year. We're in our 4th year now, and great things have happened. We won't be able to talk about all that, but this is one of those very important things. And Kassandra, I'll let you introduce yourself on the next slide.
Perfect. Awesome. My name is Kassandra Gonzales. I'm a licensed professional clinical counselor in New Mexico. I'm also endorsed in infant mental health. So my background, I have a Bachelor's of Science in Family Studies and then a Master's of Art in Clinical Mental Health. I have experience in early childhood education, so 7 years I was in the classroom before I went into the behavioral and mental health field, where I was a clinician for 7 years, specifically working with kiddos 2 to 5 who've experienced trauma. And so it kind of came full circle when this position came around. And so I've been in this consultation coordinator position for 1 year and really supporting this department in my background in education, early childhood education, as well as mental health, and starting the consultation program within New Mexico. So I'm really excited to see where it started and where we're at now.
Thank you, Kassandra. We could not be more thrilled to have found Kassandra when that job announcement went out. And my good friend and colleague, Khadijah Johnson, who is going to be here today, but is feeling under the weather. She would be remiss if I did not talk about my own experience early on and why it was so important to me that we develop an infant early childhood mental health consultation program. I had the fortune of being a family service coordinator in a Head Start program in Northeast Denver in the early 2000s, and became aware of a very robust, very similar to this. It was called the Pearl Project. But we had a full-time mental health consultant embedded with our Head Start program. And to see the changes that were made both within program administration, because they would meet with us and talk about our policies and our programs and how some of those things were impeding or impacting negatively the educators or even the families. They would just be in the classroom with educators, telling them what a great job they were doing or playing in an area in the classroom. And it changed our Head Start program dramatically. And I became just a huge champion and fan of thinking, wouldn't this be amazing if every early care and education program in our country, but here in New Mexico, could have access to these important, as Khadijah would say, a subspecialty within the early childhood professional field. So I have very strong feelings about it. And coming to New Mexico, it was so great because New Mexico has been a leader in infant mental health for decades. And so being able to bring this perspective and to build on the incredible great work that New Mexico was already doing was a real joy. So we have a vision for our SEED initiative, and this came as a part of our initial task force that we set up. And that is that the physical, mental, emotional, and spiritual well-being of New Mexico's infants and young children will be nurtured, preserved, and promoted through healthy relationships. Really love that photo, and I love that vision. And it was great because it was collaboratively brought together through this task force. So that's what I'm going to talk about is, if you go back one slide real quickly, we'll just kind of give you a snapshot, or maybe we already talked about this, but just to give you the timeline of how we set about this. August of 2020, we had a little bit of money left in our preschool development grant, and it was about social and emotional, and it spoke to me. And as I said, my earlier passion, and I said, well, let's bring together a group and see how we can keep building on the good work that New Mexico has been leading on for decades. I had met a New Mexico team when I was part of a 0 to 3 technical assistance around financing policies of infant mental health. And so a great group came together, and then we'll talk May 2021, we published our plan. 22, we reconvened to kind of celebrate where we'd come and acknowledge our successes and develop that consultation coordinator job. And then super excited when Kassandra applied in September of 22 and we hired her. So those are the early stages, and that early stages was really shaped by the task force. To the next slide, this task force was made up of 28 people. They comprised an incredible breadth of experience across the state, both practitioners, but also people who've been leading in this sector in New Mexico, as I said, for many years. We also had expertise. Don Yazzie came and helped us with from an indigenous and tribal perspective, and we had others from our tribal Head Start programs and other regional Head Start programs also were part of this, who've been doing mental health consultation as part of their performance standards for years. So you can see it was a very large and scope was broad. And again, we said, okay, let's do it for 6 months. Let's convene, let's be very focused on where we're heading to get this plan written. And it was excellent because we were able to capture in that report, and hopefully you'll have access to that, the history of New Mexico, the relationships that were already here that we were able to build on. And we focused on these 5 key areas, and Khadijah was our key facilitator. She came in and was helping us think through this along with our partner, and we'll talk about Project Echo later. Because again, as you all know, this was all virtual. So we weren't seeing each other in a room and talking and building those relationships, but we were doing it through structured meetings, breaking into our breakout groups around these 5 key areas: program model, equity, workforce development, policy and financing, and data and evaluation. Okay, so the development stage then became, we needed to develop, so we had this great report. So the first part of it, the plan is a report that just sets the context. We knew, and actually in our task force group, we had some great discussions, really trying to differentiate, what are we talking about here? This isn't treatment for children per se, it's about building the confidence and the competencies of the adults that are in that child's life, specifically in the early care and education setting. We were also thinking about our home visiting program, where we had robust reflective supervision. We had the infant early childhood mental health endorsement as part of our home visiting system. Many of our home visitors were credentialed. And so there were these important discussions that happened to say, how is this different? How does this build on that work? And how are they similar, and where's the crossover and the intersection of that work? So in July of 2022, the department, we had an initial short 18-month strategic plan, but we started building towards a longer 5-year strategic plan. And we said, we've got to incorporate this infant early childhood mental health into that 5-year strategic plan. And again, this is where we landed on a description for our coordinator. I would say the funding, we were using both federal relief funding, we were using the governor's education emergency relief, they called it GEAR. So we were piecing together these different parts of federal relief money. And then we went to the legislature also and asked for $1 million, because we wanted to see the sustainability, and knowing that we're going to need more than that over time. But we set a goal of 15 seemed reasonable. Given the resources we had, how could we start with that? We knew it was not nearly enough to build a statewide, but you have to begin and you have to start somewhere. We were talking with Arizona, who has a very well-developed model, and Minnesota, and knowing that we probably need to be closer to 60 to 70 statewide eventually, but starting with this 15 felt doable, and that we could enlist that help. And so it was great to get Kassandra on. Then we received this technical assistance that was so wonderful from Lana through the Packard Foundation, helping us really go through our own assessment, building off the plan, but going deeper. And that was very critical. And then finding 15 people, using our federal relief money to say, hey, will you become part of New Mexico's cohort that will go through and get the Georgetown certificate? And so we did, and some of those individuals are with us today. But so it's just a building and thinking of, how are we going to develop on all these different 5 focus areas? And then you'll see, I think on the next slide is where we have these are core team members, or, oh no, early considerations, yes. I'm sorry, yes, that was right. This was important to us. And again, this comes to the issues of, having both the national expertise and the state expertise around infant early childhood mental health consultation. It was important to us that we brought in these content experts that could help guide us, help inform us, consult with us. Initially, we thought we'll put out on our request for proposal and we have amazing universities and colleges in the state. Perhaps one of them would take up this call and want to become the Professional Development Institute. But again, through good conversation and dialogue, we said, this is so specific. We need to incubate this with a set of consultants. And Kassandra will talk a lot about this. Has been so much of the work that she has helped lead to make sure that it's, holding to the principles that we set out in the plan, that, you're not trying to adjust or have someone else kind of get your vision or how you're doing it. So this was our initial consideration, that we said, let's incubate this ourselves. Let's get it up and running, and, possibly over years spin it off, but we are managing it internally with some awesome consultants, contractors are helping us. We also knew that, of course, this is a new program, a new initiative. We must evaluate it. We know the research is strong on infant mental health consultation, and we wanted to be able to show our local stakeholders, including policymakers, legislators, that this approach is very valuable and that it works for teachers, for children, for program administrators, for overall classroom quality, and eventually we'll move into home visiting and other expansive parts of the early childhood system. The qualifications of consultants. It was very important to us that they be licensed or licensable, or licensed eligible, as it says here. Those are a lot of the early discussions because, again, we have in early childhood consultants, we have quality coaches, we have literacy coaches, we have reflective supervision. And so it was important for us to say, okay, this is a subspecialty of individuals that need to be licensed or licensable and have that focus on behavioral health. Some of them are going to need to learn the early childhood, but some of them, we need them to have that clinical context, that clinical training. And so focus on behavioral health agencies and individual private practitioners. And then this creation of a core team. And I know this is where Kassandra can really talk about the importance of that core team, and to anybody doing something like this to have the different perspectives. How are you building the system and the infrastructure? Who's going to deliver the services? How are we going to evaluate it? How are we going to make sure that it's, equitable and culturally and linguistically responsive to communities? So these were some of the things that we thought about a lot early on and built into our system here in New Mexico. Kassandra, I think. Oh, do you want to take it?
Yeah, I can
from here? That sounds great.
And these are all of our seed program partners, starting with our internal ECCD leadership, being with Cabinet Secretary Groginsky and then Deputy Cabinet Secretary Michelson, as well as Karen Can. She's our Special Projects Coordinator. So she supports me one-on-one a lot with development of the SEED initiative, as well as our Chief Health Officer, Dr. Gonzales. So those are our internal ECCD leadership program partners. And then we get to our content experts, and these content experts, like Secretary said, are, I believe, somewhere on our call today, which is exciting, but they're both nationally and statewide consultants that have been supporting with kind of developing an infant early child mental health consultation and what other states are doing, as well as how it affects and is specific to New Mexico. So Jordana Ash from Colorado, Dr. Allison Steyer from Arizona, Deb Harris, she's here from New Mexico, Don Yazzie from Navajo Nation, Khadijah Johnston from San Francisco. In addition, we do have on our evaluation team from Indigo Cultural Center, so Dr. Daly Jensen, as well as Ashley Mentz and Dr. Eva Marie Shiver. We have a reflective mentor team of New Mexicans and some reflective mentors out from San Francisco. So it's really excited. So Stephanie Olberry, Liz Martinez, Heather Nelson, Andrea Scott, and Hedman Walderos. And then Project Echo is our team. Project Echo is a program at UNM that supports in reaching out to rural communities to ensure that they're getting the training as in more urban areas. And very typical to New Mexico, there's a lot of rural areas, and so this is really important to ensuring that trainings and services are offered to those rural communities throughout our state. Perfect. So I'm going to talk a little bit about our implementation stage. And so we're, like Secretary said, we are at the beginning parts of our program and SEED. And so last year I was hired on to start initiating getting this up and running for the state of New Mexico. So we, in March 2023, so earlier this year, we put out an RFA for consultants. And we were able to go through the RFA process with interviews and kind of scoring from some of our content experts to then choose 14 consultants, and we contracted these consultants out starting July 2023. So these 14 consultants are both private practitioners as well as a part of behavioral health agencies. And so our goal too is as a state to really amplify our mental health agencies. So down the road that we can have consultants being employed by agencies, and these agencies would be able to train, hire, consultants throughout the state, as they are very connected with the community. And it's really important for these community members and consultants, right, to have an understanding of what the needs are from their professionals in the early childhood realm. So it's really important that our goal is to support those mental health agencies as well. In August, we did start our Professional Development Institute. And so right now we're wrapping up our Professional Development Institute. We did a 2-day in-person orientation, which I think for a lot of folks was amazing to kind of come out on the other side of COVID, right? And see each other in person, and this sense of community. Something I learned in my experience, in my mental health experience of working out in the communities away from, like, say, a typical office, was that lack of feeling supported by your colleague, right? And so we brought these 14 consultants throughout the state together in person for 2 days to already start that community of practice with our consultants in the SEED initiative. And from then on, that 2-day session in August, we've been meeting every week for professional development seminars, in addition to other webinars and series of articles, and of course Khadijah's book, and meetings internally with their reflective mentors and their groups to really excel in this subspecialty. And so exciting news: in November, later this month, we'll be opening our referral portal to then accept programs to receive consultation. And kind of going back to our Professional Development Institute, was really important for us to be able to offer these consultants an opportunity to kind of get their feet wet in observing early childhood settings. As consultation is new to New Mexico, we didn't have the luxury for our new consultants to shadow other mental health consultants. So we thought it would be a great opportunity for them to go in and just see what it is, the kind of culture of an early childhood setting. What does mealtime look like in an infant classroom? What does PM snack look like in a toddler classroom, and kind of all those times in between? So right now our consultants are in that phase of their professional development. And so it's really exciting to get them into those communities. I think this is by far my favorite picture, and I think it just goes to show where our state is and how large geographically our state is, and how spread out counties and towns are to each other, but just the kind of range of consultants throughout the state. And again, like Secretary Groginsky said, we know 15 consultants is not nearly enough to cover our state, but I feel like we got a good coverage right now. And so our hopes is to have pins throughout the state to support every community that we have here in New Mexico.
Thanks, Kassandra. Do we have a couple of things I realized? I don't know if we said what SEED stands for. Maybe it was on one of the slides, but I realized we may not have spelled it out. Social Emotional Early Development. So we call it the SEED. And some of the work of the core team that meets monthly is to just keep bringing these conversations together about system development, the institute, the content, the reflective mentors, making sure that we're thinking holistically as we build the system about all these needs, and continuing to educate both our behavioral health community in particular about this subspecialty and what it looks like, and how hopefully many of them can come on board, because as you see there, it's mostly individual consultants, which is fantastic. But we want to see more stability and sustainability by building the capacity of our behavioral health agencies to take on this important initiative. and reach children so much earlier by building, again, the confidence and the competencies of their educators, their home visitors around social and emotional development. We wanted to leave plenty of time for questions. We can fill in more details if we need to, but love to see if there's any questions.
I think I am going to stop sharing.
And Kassandra and Secretary Groginsky, I'm not seeing anything in the chat yet. But please, everybody, feel free to either raise your hand, we can take you off mute, or put your questions for them in the chat.
And just if anyone even here on the chat is working in a program in another state, anything that you notice similar to what we're doing or something different, would love to hear. How are you thinking? Yes, great question, Lee. Moving forward, how are we thinking about how to identify where consultants should be located? Kassandra, you want to?
Sorry, I'm having some technical. Okay, moving forward, how are we thinking consultants should be located? So right now we're getting an idea of the need when we're going to be doing a couple webinar series that's reaching out directly to early childhood educators. And so that's going to be one portion in which we are really leaning into knowing where and some of the consultants are needed at, as well as something I am working with. I'm part of a fellowship out at Bank Street, and part of that fellowship is supporting me in finding areas in which communities are needing most support. And so that's something that I'm working with my mentor through Bank Street to really identify what are those areas in most needed support.
Yeah, I think that's excellent. And as the agency, we also are the agency that regulates and administers the child care assistance program. So we have the data on, how many child care programs we have in different parts of the state. And so I think we're going to start getting more granular like that, as like Kassandra says, as she's working with her mentor and thinking of ways that we can use data to drive some of that decision making, and also where we have strong behavioral health agencies and continuing to build that subspecialty. SEED is social emotional early development. And so that is SEED.
We have one question from Francis, who would love to hear more about the referral program.
Okay.
Yeah.
Yes.
And so
good.
as far, let me see, I think she asked what types of information. So the types of information, very similar or very kind of minimal of kind of directors information. One thing we are really encouraging is that directors are the ones making that referral for consultation. Even if a family or teachers is needing some support, we're really wanting to encourage those individuals to speak with the director, as they're going to be the holders of the door for consultants to enter their program. So we're really wanting them to be on board. Something Khadijah always says is, we don't want to be an unwanted gift. We really want their doors to be open to consultants. And so the best way is to have those directors buy in for that as well. Other information that we're asking is just what challenges brought them to making a referral. Again, what areas they're serving in the community. There was kind of going back and forth of if we want to talk a little bit more about kind of what their policies and procedures are, but ultimately what we decided is that's very personal. And so we really want that information to be talked with their consultants, right? Starting to build that relationship. So a lot of the items or items that we're requesting during our referrals, very basic information. A lot of the more in-depth questions, we're really holding off until the consultant can start building that relationship with the director in the program.
Love that. Thank you all so much. They're coming in now, so we have lots and lots of questions for you. The next one we had was, what has been your biggest challenge?
I'll let Kassandra answer that.
I think the need for service, and I think that's the need for service and really wanting to, and time. I'll say need for service and time, because again, everybody was like, sign me up when we first started, right? And we're like, okay, yes, everybody wants to sign up, but we want to make sure that we are supporting and giving professional development to all of our consultants so that they're entering the field highly qualified, because they came in already highly qualified, right? So we wanted them to be prepared. And I think time and the need for service would probably be the biggest challenge. Definitely kind of implementation stages. And Secretary, I'm going to kind of pass it to you if there was any challenges, kind of initial stages developing.
Yeah, I think you hit on it for sure, like the need, because I think it was in April, Kassandra presented at a statewide NM Association for the Education of Young Children, and she had a room full of people who were exactly saying that. Sign me up. When does this start? And we're like, okay, we're just kind of getting, tomorrow morning she's doing the whole community on the community call. She's going to introduce the portal. So wish us all well. I would say in the early stages, it were some of those discussions I talked about, really teasing out, what is this subspecialty? How is it different from infant early childhood mental health, treatment, intervention, also reflective supervision? All those parts are important and are part of this, but there were a lot of good discussions trying to tease that out and not think that we're going to replace this, or that all that is not still very important. And so I think working through that, creating a theory of change, which Don Yazzie helped, Deb Harris, Khadijah helped us with that theory of change, where we could show how this approach, this consultation seed was different from those. And we have a strong infant mental health program at our Children, Youth, and Families Department. And so we've talked about that as, when we see families who need a higher level of intervention, that it isn't going to be just helping that teacher, that family needs a referral, making that referral to our infant mental health team at the Children, Youth, and Families Department, and having that interagency collaboration is so important. We do think there's probably going to be a lot more need than we're going to be able to address. So that'll be another data point to help drive our decision making about where to bring in consultants. But we don't want to just bring in consultants because here's where all the population is, because we know the need is everywhere, and we're a highly rural state, and very many places they refer to as frontier, where there's very little services, but there are needs for children and for the educators who are working we've just had a massive expansion of pre-K in our state, hundreds of more classrooms added, lots more children in settings where they may have not had early childhood experiences before. So building the confidence of those educators to support social and emotional development is mission critical for us, we feel like, to achieve our goal of school readiness. So that was a long answer, but thank you for that question.
It was a rich answer. Thank you both. Jen asks, what work did you do to develop your own model of service delivery? And did you develop a program manual for SEED?
And so all of that.
Go. And well, I'll just say that was one of our model development, was one of our areas that we focused on in the plan. It was a 3-year plan that we set out in 2021. And so we knew that was going to be important. And Kassandra can talk more to the robust discussions they've been having about our model and where we are with developing the manual.
Absolutely. And so the model just comes down to what's going to be best for our state. And so we've worked with a lot of our national experts on what other states have developed and what's worked for other states, and something that, again, we continue to say our state is very unique, New Mexico, as there's a lot of those rural areas. So something that may work in one of our urban cities in New Mexico may not work for one of our rural areas and tribal areas. And so we're very cognizant of that, and ensuring that our own model of service delivery really is equitable to those areas throughout New Mexico, because it really does look different throughout the state. And so that's something that's going to be always developing and co-creating with programs, with consultants in those areas, especially those areas that are a lot more rural, because they're experts on their own community. And so we're really leaning into those consultants in those areas to support that model. And as well as the program manual, something that we're still continuing to develop as the program is developing. So we don't have a manual set in stone yet, as far as kind of signed, still delivered. Again, it's still being developed as we speak.
And that's some of what you saw on the slide with our various partners. We have evaluation partners, system developer partners, the content, the expertise of what's going to deliver on the professional development, kind of that design of, getting people out into the field, working with what we call our quality rating improvement specialist coaches, just doing some meet and greet. Oftentimes in the field, there's a little tension there, like, oh, well, what? And also being cognizant of the director in the program, like if they have a pre-K coach or a literacy coach, and then they have someone coming in around their licensing facility, and now we have this other person. So having those system developers who have done this for years in 2 of our neighboring states, helping us think through what needs to go into our program implementation, into the system manual, thinking about the readiness of the provider. If we go in, and especially as a new implementation with limited number of consultants, we're thinking about how, do we go in for 6 months? I think that's where we're at right now, just because of the limitation. Like if you want it, then it, I came from a program in DC where it was just on and on and on. It just went on year after year. There was more capacity there. So we have to think about that part of our program model. How many classrooms can a consultant really provide consultation to? If they're in rural communities, they're going to have an 1.5 hour drive between 2 facilities. So, but those are the things that Kassandra and the team, the core team and the partners are working through. And I do think the readiness, from my experience, both in Colorado where I was, but then in DC as the assistant superintendent of early learning, where we had a very large mental health consultation, was that readiness, because these are very it's like you go into a program, and that's why we started the referral portal with the director needs to submit, because if the director isn't on board, we consider them the instructional leader in the building, the person responsible for holding all the regulations of the facility. They need to be able to manage and support consultation coming in. And so there was a good discussion again, should parents be able to refer, and teachers and others? And, as we evolve, that may become something that we can do, but with this limited cadre and this need for buy-in at the highest levels of the facility to be successful. That was some of the direction that we went. And these are the things that are getting documented by Kassandra, by our developers. So I would say we probably will have a seed manual by spring, probably the end of the spring, both looking at our professional development institute, because we're that continuous quality improvement. As we do it, we're learning this worked really well. I think we were all just blown away by the 2-day in-person, just the level of engagement and learning and connectivity and relationship building that went on, and then that ongoing professional development. So we see the formula that's working, and then how often do we need to repeat that in a year, to build this cadre. So, Deb Harris having her here, and Don Yazzie, these are just, we're fortunate because we're building with some of the best minds in the field.
Yes, I second that. Working with them. So I'm actually really excited because I'm thinking you guys have got to come back next year. We have a lot more to learn from you as you build this out. The next question we have is, how does SEED intertwine with other ECECD programs within the division?
Great question. And I mean, I could speak a little bit, but I think Kassandra is, deeply embedded within what we call our Policy, Research, and Quality Initiatives Division. And so that's covering all the quality support, scholarship, wage supplements, the quality rating improvement system. So she's in those conversations, but with Karen Can, the Special Projects Coordinator, who sits under the Deputy Secretary, who's over all programs, childcare, home visiting, early intervention. Kassandra can, easily be, in those meetings, talking with those bureau chiefs, getting ideas, building that. We're actually bringing in some inclusion coaches to our early intervention family infant toddler program, Part C, for infants and toddlers with developmental delays and disabilities. And we see already opportunities here for Kassandra and those inclusion coaches to be talking to, where are these behavioral health challenges, the educator, and with our licensing team, because they're going out and seeing, staffing issues, but they're seeing health and safety issues. How can we come in there and, talk about just the room arrangement? I see Kassandra and some of these consultants being able to provide professional development to our early childhood professionals around some just foundational pieces that is going to make everybody's life a lot easier when people understand the environment as the third teacher in that room, and how do they set those classrooms up to support social, emotional, early development. And then home visiting, I think I'll let Kassandra, because she's doing it. So those are the ways that I see it, very embedded. And because she reports, both at that high level up to people who are looking out across the department, that integration is happening on a daily basis through meetings, conversations, and strategy.
Exactly. And being part of the State Department of the IECMHC program, I think it's really helpful because I'm able to have access to those bureau chiefs, right? The regulatory team, our quality rating bureau chief. So again, having all of those individuals work together, right? And not siloed. So we're always working together. And part of our referral process is getting together with our regulatory team, because again, the regulatory teams in the programs, our education consultants are in the programs, right? And how we're working together for one cause, right? And that's the wellness of these infants and young children, as well as the educators in New Mexico. And so that's definitely something that we've seen working together with other divisions, directors and bureau chiefs and things like that. And so that we're working aligned and collaborative.
All right, everybody, we have a few more minutes. If anybody has any burning questions they'd like to put in the chat. But Secretary and Kassandra, I hope that you both are seeing all of the wonderful comments that are being put in the chat. Thanking you. Yep, and those just keep coming as well.
Nice. We appreciate that. Yeah, tomorrow's a big day for the state. We're going public with the portal. So we're going to need, and I think, just to build I'm excited. Like when we were having a hard time getting behavioral health programs to kind of step up to the call, I started calling CEOs of behavioral health. That's the other good thing. We're in this agency, or in the cabinet secretary. I can pick up and call a CEO of behavioral health, and they'll take the call. And it was just interesting. It's that we have a lot of education to do in the behavioral health community about this subspecialty, but they were intrigued. They were intrigued. They're trying to get their head around it. Like, where's their mental model for this work within the context? Because we have a very strong child parent psychotherapy program in our state. And that's, that's fantastic. I think we have somewhere between 60 and 70, maybe even more rostered CPP professionals, which is what, prompted us to say, that's how Minnesota built theirs, and other states have looked at that. And so that's very familiar to many of our behavioral health So that's the exciting work we have to do ahead, I think, as these couple agencies that we do have and these consultants start helping us message. We have a communications team that's dedicated to getting our messages out. And so they work with Kassandra and put together flyers and presentations, but we have that learning of how to reach into the behavioral health community with this subspecialty, and see that some people might, they'll do CPP, but maybe half of their time they'll go do this upstream prevention work, and they'll get in there and work in classrooms or work with a home visitor. So that's the exciting building, and we appreciate you cheering us on and seeing the development of this, and we'll keep reporting back. Hopefully annually we can keep seeing the progress each year that we make. And I honestly, I can't say enough about Kassandra's leadership and her style and her openness. And she has many people coming in with different ideas. And she, it's that bringing all those ideas and perspectives together into a unified whole that isn't easy, but it is a very collaborative. And we can't say enough about our partners and our community. So we're excited, as Kassandra would say, awesome, and we're super excited, and it's perfect. Those are her favorite. I always like being with her because those are her three good words. It's awesome and perfect, and we're super excited. So.
And one thing they didn't mention that we're doing to kind of go off what Secretary was saying as far as development of agencies throughout our mental health agencies throughout the state is we're providing a TA to our current agencies and their clinician or their kind of clinical supervisors within those agencies to support them in understanding how to hold a consultation program within their mental health agency. So that was embedded within our professional training institute to really support and lean into the growth and development for those agencies. So again, that's definitely our goal, is to build up those mental health agencies throughout New Mexico.
I love that. And I got to work with Kassandra and a lot of the team when they were going through the certificate program. And I just have to echo what Secretary Groginsky said. They are so passionate and involved. And I was like, I left every meeting just feeling so energized. So yes, I echo everything that everyone has said in the chat about your passion being so evident, and what a great presentation this was. It doesn't look like we have any other questions, just a lot of love for you all. So thank you so much for your time. We really appreciate it. And I hope we get to see you again next year and learn about your progress.
Sounds great. Thanks, Jen. Thanks, everybody.
Thank you all.